Obesity is now the current leading cause of cancer in the world. It's actually beat out tobacco smoking. Tobacco used to be number one. Now it's obesity and overweight. Obesity and overweight is responsible for 600,000 cancer cases per year. Soy is one of the most powerful protective foods against breast cancer, prostate cancer, and other hormone-driven cancers like uterine, ovarian, and endometrial. So whole soy foods like soybeans, the actual beans, or edamame, tofu, tempeh, organic soy milk, as well as miso paste, for example, are all really powerful cancer-fighting foods.
Good day, everyone. Welcome to the VoCP Talks, a platform to empower the cancer community. Our guest speaker today is Hanna. Hanna is a registered holistic nutritionist and a certified holistic cancer practitioner. So thank you so much for joining us today, Hanna.
Thanks for having me.
Let's get started with cancer protective lifestyle. And I'd like to know what all it includes.
A cancer protective lifestyle, it's actually 4 major factors that are involved in cancer protective lifestyle. Number 1, our diet, which is the main focus of living an anti-cancer lifestyle. And then we have physical activity, not smoking, because that is one of the leading causes of cancer, of course. And also not smoking and maintaining a healthy body weight. Those are the 4 main factors.
You are a cancer practitioner and also a nutritionist.
Yeah.
So what led you to focus on this area and become a cancer practitioner?
Yeah, great question. So I actually went through cancer myself at the age of 20 in 2006. And I was actually, studying to be a dental hygienist, which I actually finished that program as well. But my soul called me to work with cancer patients just to help them through something that I've already been through. And I did so much nutritional therapy and lifestyle therapy, herbal therapy through my own journey. And all I wanted to do is support other people in doing the same thing. So it led me right into the world of nutrition and helping others.
So in your experience as a cancer practitioner, what are some of the major problems that you find patients face when it comes to their diet?
That is a great question that many people don't consider, because sometimes you just want to give advice like eat this, don't eat that. But when you're going through cancer, it's not the cancer itself that causes, typically it's not the cancer itself that causes obstacles around nutrition. It's actually the treatments like radiation and chemotherapy. Sometimes the cancer itself, if you have like an obstruction in the, for example, in the esophagus or something, or in the gastrointestinal system, but mainly it's due to chemotherapy, radiation. And those obstacles include things like mouth sores, nausea, of course, vomiting, lack of smell, lack of taste changes, alterations in smell, taste, food preferences change, our taste buds change. Eating can be really painful because chemotherapy and radiation can really damage that gut, that lining, that basically lines all the way from the mouth down to our, the end of our gastrointestinal system. And so we really want to support patients with nutrition. However, keep these things in mind as well, because sometimes they're not able to eat what we'd like them to eat as nutritional practitioners.
More than going through cancer, it's the treatments that they undergo that lead to these diet-related issues.
Yes, exactly. And to be honest, the main obstacles that I encounter with my clients are nausea. That's nausea and mouth sores, and those are both modifiable through nutrition and through supplements were indicated, and so they're definitely factors that are able to be supported. So it's not something that we can't work around, but it's definitely something that we have to address. Yeah.
So does a cancer protective lifestyle also help a patient's mental health? Are there any vegetables or fruits or any other food items that contribute to this?
Yeah, and this is a great question as well, because when we think about, mental health with cancer patients, it's actually probably the most important thing that I like to address with nutrition, because if you're not of a mindset that is, if you don't have clarity, if you don't have a positive mindset that's supported, of course, through nutrition, then and a lot of our mental health, of course, is, then how are you going to go through something so so strenuous on your system? And so yeah, there are a variety of foods that I like to focus on, specifically foods that include specific nutrients such as omega-3 fatty acids. So omega-3 fatty acids, of course, are the healthiest fats for our brain health and our mental health. And those fatty acids are included in foods or rich in food sources such as walnuts, flax seeds, chia seeds, leafy green vegetables. Most people don't think about that. Leafy green vegetables are really rich sources of omega-3 fats, as well as hemp hearts, and of course fish. I'm a plant-based practitioner, so I don't really recommend fish often, but I do recommend the richest sources of omega-3 fats, which is actually flaxseed, and you want to make sure that it's ground. Otherwise, you're not getting the omega-3 fat from the flaxseed. And the other nutrients that are important for brain health are actually protein is one of them. So again, focusing on foods that are, I always recommend focusing on plant-based sources of protein because they are packaged in fiber and phytochemicals and antioxidants that support overall health. So foods like beans, lentils, again, nuts and seeds. And then the other category of foods that support brain health are actually foods that are rich in antioxidants that help to combat the cytotoxic effects of chemotherapy, radiation, and other phytochemicals, so plant nutrients that support overall body function, reducing inflammation, reducing oxidation in the body, and just supporting our brain health that way. And those foods are the berries, for example, that are rich in polyphenols, greens, again, leafy greens like spinach, kale, watercress, bok choy, etc. Beans are really rich in antioxidants as well. Whole grains, nuts and seeds, spices, herbs, etc. So any food that is a plant will be typically really high in antioxidants.
So you mentioned flax seeds. Like, are whole flax seeds not as beneficial as ground ones?
Yeah, so most people still don't know this, but yeah, they're not, because the whole flax seeds the seed is encased in such a thick coat, like a coating, and like a shell,
Yeah.
the shell. And so you're not actually able to access the omega-3 fats inside the seed unless you ground them. So always, you can buy them whole and then blend them in your blender or processor or coffee grinder and grind them that way, or you can purchase the actual flax meal. Yeah.
Okay. Has any link between obesity and cancer been discovered?
Yes. Yes, actually, obesity is now the current leading cause of cancer in the world. It's actually beat out tobacco smoking. Tobacco used to be number one. Now it's obesity and overweight. Obesity and overweight is responsible for 600,000 cancer cases per year, which is staggering. But again, it's not something that typically we talk about in the public realm. It's a very sensitive, obviously, topic, but it has to be discussed because 40% of all cancers that are diagnosed are linked to obesity and overweight. So we have to really do this and put this into the really just put the conversation forward, because it's so important, because obesity and overweight are so modifiable, of course, through our diet and our lifestyle. And obesity, overweight is responsible for various cancers. It's linked to 13 now by the World Cancer Research Fund. They've proven that link. And because fat cells are biologically active. They don't just sit there. Our fat doesn't just sit there. It's active metabolically. And so it produces growth factors, growth hormones, inflammatory mediators that all support cancer cell development and progression, unfortunately.
Are there any vegetables or fruits that are known to help with fighting cancer?
Yes, there are several scientifically proven cancer-fighting foods that I actually, I have a PDF that I share with my clients or anyone in the public on my website. You can download it for free. It's basically a list of cancer-fighting foods that you want to include in your diet, and how, tells you how much is proven in the studies to want that you you want to target to consume per day. So they include foods like berries. So blueberries, blackberries, strawberries are really high in ellagic acid, for example. Then we have the category of cabbage family vegetables. So cruciferous vegetables, including broccoli, broccoli sprouts, bok choy, cauliflower, kale, watercress, arugula, etc. These are all the foods that are the cabbage family. Cabbage as well, I forgot to mention the main one. And then we have the foods like the garlic and onion family, the allium family. Those are actually very, very powerful. Garlic is said to be the most powerful anti-cancer food on the planet, based on some studies of extracts that were done and dripped onto cancer cell lines. Garlic was shown to be the most powerful. So the other list of foods, I can just go through them quickly, are flaxseed, actually. Flaxseed is very potent for fighting hormonal cancers like breast, uterine, ovarian, endometrial, and prostate. And then the others are turmeric. Actually, chocolate, like dark chocolate, is a cancer-fighting food because of the antioxidants, which is nice to know. And we also have citrus foods because they contain compounds that are cancer-fighting. And the other one that I always talk about with my clients, especially for hormone-driven cancers, is soy. Soy is one of the most powerful protective foods against breast cancer, prostate cancer, and other hormone-driven cancers like uterine, ovarian, and endometrial. So whole soy foods like soybeans, the actual beans, or edamame, tofu, tempeh, organic soy milk, as well as miso paste, for example, are all really, really powerful cancer-fighting foods.
So when someone gets diagnosed with cancer, their world turns upside down, as you might have also experienced from your past. And is there any way to navigate through this and find joy again?
Yeah, and this is like the thing is that when you're diagnosed with something like cancer, the key to healing, I believe, of course, nutrition is very important, and supporting the body with appropriate nutrition is so critical. But what you actually want to focus on first is finding that joy of living again, making that choice to want to live. And once we do that, we have to step into our power, right? Connect to the source of joy and love, and then healing can actually occur. And how do you do that? Based on my own experience and my clients, I believe that the first thing you want to do is get clarity and step away from the situation, because cancer is not something that happens overnight. It doesn't just pop up overnight. It's a disease that's chronic. And so once we're diagnosed, not childhood cancer, but in adult cancers, once we're diagnosed, typically we've had this disease in our system for 10 to 20 years. So you don't have to make decisions that second that you're diagnosed. You can step away, which I highly recommend. Go away for a week somewhere in nature. Go to a retreat, meditation retreat, yoga retreat, or just go camping. Just take time away and get clarity, meditate. If you're a person who prays, pray. Try to get guidance from a higher power, or your higher self, and listen to your instinct and your intuition, and then come back and then make your decision about treatment. And then, surround yourself with people that love you, that support you, that make you laugh, that bring you peace, bring you joy. Watch comedies, watch, like funny shows. Really just hone in on supporting your nervous system through like calming activities like meditation, again, like yoga, maybe acupuncture, just like really calm your system so that you're able to step into that healing power of your mind and your soul.
So once you're diagnosed, stepping away from the situation and finding more clarity is one of the best things to do.
In my opinion, other people might disagree, but I find I traveled to an institute in Peru for 1 week that treated my cancer with herbs as well as recommended chemotherapy back home in Vancouver, Canada. And that week for me was so enlightening. And I just realized, like, okay, I have so much power here. Like, I don't have to make a decision on chemotherapy today. I can think about this. I can meditate on this. And I did. And then when I came back from that week, everything changed. I found a new doctor who was more individualized to my care. I became, very, very clear on what my body needed. Right. So that's my biggest source of advice.
So you went for other herbal treatments. So our next question is related to that. Apart from the standard medical therapies that most people are told to undergo, what other treatments or care must a patient receive to go through this journey better or quicker?
Yeah, and that's another amazing question, because we think about like chemo and radiation being, some people think that that's the end all be all, but that those therapies just shrink the tumor. When you have cancer, you have an imbalance in your whole body, in the body. It's a systemic disease. And so we want to definitely treat the whole person, not just the physical body, but the mental and the spiritual as well. So in terms of, integrative cancer care, I think it's critical that we don't just stop at chemo radiation, that we do seek out a nutritional therapist or a dietitian who will help support the physical body through nutrition. Then we seek out maybe a naturopathic oncologist who might support us with vitamin C IV therapy, or herbal remedies through a certified herbalist or a naturopath. Acupuncture is very effective at helping to support treatment and reduce side effects of treatment like nausea. We also have modalities like even integrative energy healing is really, really powerful. I did that a lot through my treatment, and other modalities like ozone therapy, maybe hyperbaric oxygen therapy. There are so many different modalities that we should be at least considering when we are undergoing cancer treatment, because we don't just want to support healing in the whole body, but we also want to reduce the side effects of chemotherapy, radiation that are not so great, right? Because these therapies are highly toxic, unfortunately, and we want to protect our healthy cells as much as possible through nutrition, through herbal therapy, through mind spirit exercises, to really just get our body and our entire being in a healing state. I think that's what I discovered. And if you don't discover it through cancer treatment, I believe that most people discover it after. So it's as important during treatment as it is after. Even if you haven't done any of these things during treatment, that's totally okay. But make sure that you are doing everything in your power to heal the body and recover and repair after treatment.
So you mentioned integrative cancer care. Could you elaborate on that, and what all does it target during treatment?
Yeah, so integrated cancer care, what you want to do is you want to, again, my opinion only, is set up your cancer care team, right? So, for example, you have your oncologist who will be giving you medical treatment like chemoradiation surgery or immunotherapy. Then you want to seek out maybe a nutritionist. Then you want to seek out maybe a naturopathic oncologist. And maybe you have a care manager. That could be a friend or a family member who actually just helps you manage this whole system, this whole support care team. You want to seek out maybe a traditional Chinese medicine practitioner who will help you with acupuncture, acupressure, massage, and maybe herbal therapy. And then maybe you want to seek out a lymphatic massage drainage, RMT, like a therapist, for pre-surgery, after surgery. And so you get your whole team, and let's not forget like a therapist, a counselor for your mental health, or a spiritual teacher, maybe joining a spiritually focused yoga studio that helps you, that teaches you how to meditate as well as move your body, and then connect to the mind, spirit, body element. So I would say integrative cancer care supports mind, body, spirit, and it supports all the other imbalances in the body that are highly common in cancer patients, which are inflammation, oxidation, poor blood flow or circulation, which is common as well, imbalanced stress chemistry, like high stress levels, and of course a compromised immune system and compromised gut health. So when you have integrative care, you target all of these different imbalances in the body with the whole support of your entire care team.
You are a plant-based nutritionist.
Mm-hmm.
So I would like to know if plant-based diet has been proven to be more effective against cancer, or does it help better with recovery?
Mm-hmm. So we actually, it's not proven that it helps with during cancer treatment. The studies on during cancer treatment are not available to us. It's very inconclusive, but we do know since for decades, actually, 1960s, we know that the most optimal diet for preventing cancer is a whole food plant-based diet. We know that this to be true through, decades of research and reviews that have been redone and reestablished, and basically proven that a whole food plant-based diet, so a diet that's predominant in whole plant foods like whole grains, vegetables, legumes, nuts, seeds, and herbs, is the most powerful way of helping to prevent and reduce your risk of cancer. But is this the diet that is proven to be more effective in enhancing treatment outcomes? Not proven, but we can kind of reason that if this is the diet that's most effective at preventing, then it goes to reason that it would be also the most effective at helping to suppress cancer cell growth during. So what we want to focus on is helping to, inhibit tumor cell growth, induce tumor death, support the immune system, basically target cancer hallmarks like vascularization, which is called angiogenesis. And so through these plant foods is the only way to do that, because specific phytochemicals in plants in terms of diet have been found to target these specific aspects of cancer. And so I think that a plant-focused diet is the most effective way of doing that.
Maybe more research will be conducted in the future with more accurate research.
Yes, we need more studies for sure to prove that. But for now, we can just, rationalize based on what we know for prevention. Mm-hmm.
Okay, so my final question. Cancer patients and survivors often have a higher protein requirement in their diet, but they find it more difficult to consume and reach this requirement as well. So do you know if there are any ways that they could consume protein more easily?
Yes. Okay, so this is so important because during cancer treatment, we tend to, there is a risk of muscle mass loss. So we need to really support our system, and especially our lean muscle mass, through protein. So cancer patients need more protein, like 1.2 grams to 1.5 grams per kilogram body weight, which is more than the typical person would need, which is like 0.8. And to get the protein in, we can do, of course, focusing on plant foods or foods that are rich in protein. I mean, if you're going to eat meat, then of course we know that those foods are poultry, red meat, dairy products, as well as eggs. But in terms of plant-based sources of protein, we want to focus on legumes. We want to focus on nuts and seeds and whole grains. And vegetables too have protein as well. But to get the protein in for my clients, what I do is I recommend ground flaxseed in smoothies, or oatmeal. Oatmeal itself, because oatmeal has 12 grams of protein per cup cooked, versus like an egg, which has 6. So I recommend whole grains as well. Using nut butters, using like peanut butter that's natural, almond butter that's natural, maybe pumpkin seed butter, and incorporating that into your smoothies or your oatmeal. Even using like a very limited ingredient protein powder in your smoothie in the morning, or in midday, such as a pea protein powder or a pumpkin seed protein powder or hemp, is really effective as well, just to increase that protein level. And then, even using protein powder in your oatmeal is actually a really good way of doing it. And then, or hummus, adding it to hummus or bean spreads or anything else, just to increase that protein intake. And just focusing on using spreads like hummus, bean spreads, lentil spreads, etc., to really make sure that you're hitting like 25 to 30 grams of protein typically per meal.
So as someone who has gone through this journey yourself and who is currently a cancer practitioner, what's your message to cancer survivors and patients?
My message is to never stop being an advocate for your own care. and listen to your instinct with everything. Like in terms of like, does this feel right for my care? Does this treatment feel right for my care? Listen to your gut. It's always smarter than your intellect, in my opinion. And also don't forget that, you know, there is nobody that can actually tell you that, you know, what your prognosis is, because you're not a statistic. You're not a statistic in the studies based on populations. You're an individual, and there is always, always hope for healing. There's never, ever, you know, it never ends. So just, that's my biggest message. Advocate for your care. Listen to your instinct, and remember that you're not a statistic.
So thank you so much, Hanna, for this wonderful session and joining us on this session on cancer nutrition. Your insights and the information you provide are very incredibly valuable, and I'm sure many of the viewers must have benefited. So would you like to tell them how to find you on social media or get your services?
Sure. Thank you. And thank you again for having me. You're a wonderful host, and I'm so happy to connect with the community here. And yeah, my website is, you can find me on my website, backtobalancenutrition.com. My Instagram is also Back to Balance Nutrition. And yeah, again, you can just download a free PDF guide for cancer fighting foods on my website. And my services are also listed there. So I work with people one-on-one. I also offer a online course that's called the Anti-Cancer Diet Kickstart that you can get on my website. But if anyone has any questions, they can just contact me through my website or on Instagram, and I'll be more than happy to answer any questions that they have.
Thank you, Hanna.
Thank you.